Muskan, and I would like to welcome you all to the first panel discussion of the day. The topic for this discussion is incubation and innovation in the social sector for public health. This is being live streamed in university's YouTube channel. Now, I would like to call upon Professor Arima from School of Development, Azim Premji University, to come upon the stage and to proceed further. Thank you.
Hello everyone and welcome. Welcome to the audience who is seated here, but also those who have joined us online on the Azim Premji University YouTube. Welcome everybody, and I think I'm quite sure, not only hope, but I'm quite sure that all of you have enjoyed the tour to all the stalls, because I have enjoyed a lot. And just to realize the power of ideas. The ideas can look simple, but the impact that it can have on lives of so many people. It's an honor and privilege to be moderating this panel with three panelists who bring so much of rich experience, to this particular theme. In no particular order, I'll invite, and please come and to the be here. So I invite K. Chandrashekhar, who is the founder and CEO of Forus Health, and he's the brain behind the development of the technology platform that really addresses one of the key challenges in terms of access to eye care and prevent blindness. So welcome. The second is Jenaan. I hope I'm pronouncing your name correctly. She's a development professional, has worked in several different kinds of social enterprises for more than 14 years, and she is the Chief Operating Officer, Villgro Innovation Foundation. We have Dr. Satya who is currently a member Board of Directors and Sil Venture Center, and he has to his credit design and implementation of several national level biotech and medtech innovation programs in the country. So, and continues to be passionate about social entrepreneurship. And so thank you, everyone. What we will do is that I'll begin with a very broad question, right? When we look at healthcare, some of the things that the challenges that we're very familiar with are in terms of access, right? Access to actually sometimes very basic services that we are talking about, as basic as something, women struggling to have even access to antenatal care, right? And, considering the fact that we are also in India undergoing triple burden of disease that we talk about, right? We have kind of problem of undernutrition, we have communicable diseases, and we have emerging non-communicable diseases. These are the kinds of challenges that we are talking about in terms of access is one. Second is also in terms of timely access that we are talking about, which is very important, right? Timely access which can have, and to quality care, which can have an important impact on the morbidity and mortality that we are talking about, right? The third is also about not just quality care at any price. How do we actually make care affordable? That's one of the important challenges that we are talking about in the healthcare domain. Considering the kind of a landscape in the challenges that we are talking about, I would like to begin asking each one of you in your comments on what you see as the role of broad social enterprises in addressing some of the challenges. So I'll begin with you, Jenaan.
Thank you, Professor Arima, and thank you for inviting me here. I'm among stalwarts. And just to share a little background, I work with Villgro, which is an incubator for social enterprises. We've worked with startups in healthcare for many years now. So my view and the perspective I bring is from the incubator angle, right? Unlike a very in-depth experience that my colleagues here have. So in our understanding and in our experience, Villgro focuses on working for low-income populations, right? Any enterprise that we work with has to be a solution that's able to address the need for low income. And what we've seen is social enterprises or market-based models to providing healthcare are a fantastic way of doing exactly what you talked about, Professor Arima, which is providing accessibility, affordability, and another thing that we've learned about is making it acceptable. making it acceptable to use. Um, one of the companies that we worked with, that's even mentioned in Mr. Anil Miskit's book, is a company called Biosense. And what they developed was a low-cost, non-invasive anemia testing device that could test through the eye with a technology that was attached to a mobile phone. Now, before this, again, an issue that you referred to is the issue of not having antenatal care accessible. A number of women in India die purely because of something as simple and preventable as anemia, and it still happens. When the government rolled out iron tablets across primary health centers, across villages, using ASHA workers, fantastic idea. But what happened is, because iron tablets also cause constipation, so many women said, you know what, pregnancy is hard enough. I'm already constipated. I don't need something making me even more constipated. I'm not going to use this anymore. Why? Because this was a tablet that came to the doorstep. They didn't know whether they were anemic or not. Going to a testing center means you lose a daily wage and to actually get the test done and then to go back to get your test results. So what this did was, it made the test of anemia accessible at the doorstep. It gave the result immediately, and it also made everybody understand that this can actually put my health and my child's health at risk. So constipation is a small price to pay. Right? That's a fantastic example of accessibility at the doorstep, affordability, because this was actually purchased by the government, and acceptable because iron tablets were not acceptable because of constipation, but now taking it became acceptable as a solution. So I think that's an example of the role that social enterprises can play, and to actually make it to make the low income come into the market and be part of the market as opposed to be excluded from it. Okay.
That's very interesting. Thank you. Yeah. Chandrashekhar, yeah.
First of all, thank you for the opportunity. My name is Chandrashekhar. I'm CEO of Forus Health. See, my take on the whole thing is, in healthcare, innovations are required to solve a lot of problems. We have issues like number of doctors being less, and that will continue to be there. So we have two problems. One is first level diagnosis, and second is treatment, and third is continuous care. There are three different things, right? So if you have a chronic diabetes, you have to be in continuous chronic care. What I would not go to this word called social enterprise. Primarily, I think the only difference I see between a non-social enterprise by definition and a social enterprise is you need tech which is access. So you can't make a product which is not acceptable in the mainstream, but something which is like a specific social enterprise where you are using. I think the product or solution should be acceptable everywhere, right? The social enterprise probably will do what consumer brands did, like sachaying the solution, right? They will not, so they will give it in smaller volumes to suit the needs of people and cover a larger stream of people and recover the cost or the recurring cost over a period of time and be profitable, right? So because it is available at a smaller volume, accessible to people, it is acceptable and affordable to people, but at the same time, it is also the same solution, because end of the day, the poorest of man is also aspiring to get the same level of treatment what some of the big hospitals are getting, right? So you can't tell him like you're poor, so you will get something which is, something which is low down. So the aspiration is there. So again, in our case, if you look at blindness, see, the very important thing in India is it's not about identifying a problem. It is about identifying the problem and telling the person, and that person should take the next step for treatment. Now, unless that person takes that step, there's nothing you can do, right? So it will still remain, right? So when will that person take the step? Only when he's convinced that he's got a problem and a solution is available, and that solution is on par with what was available, what the rich people get. So in order to make that is when the real problem will get solved. So it's access and affordability and all these things are there. But everything is all behavior. It is connected to people behavior. Now, even if you tell somebody they are diabetic and they know their HbA1c is whatever, they still don't follow it because it is lack of behavior. So, if you have to solve these problems, it has not only to be access affordable and all of that, which is a given, but I think it has to integrate with the behavior of the individual. At the same time, you can't make a dramatic shift like, okay, people were not doing something, they will do, if they do this, then it will change, it will never work. So it has to be that incremental difference in the behavior, which will kind of integrate, that is when it will happen. So most of these solutions, that's where social enterprise can play a role because they are connected to people and not connected to just a solution. They are connected to people getting the problem solved, right? At the same time, profitability, all that is fine, but they're more bothered about people getting their problem solved. So I think that is what probably should differentiate the common solution to a social enterprise solution.
Very important point, these people focus. Yeah.
Okay. Thank you, Arima, for the invitation, and again, congratulations to Anil for the book today and the social Mela. What a wonderful, buzzing place this has become, and what a wonderful university. So 3 cheers to APU, all you undergrads and postgrads. My name is Satya, as you know. I'm a nomad and I create innovation platform wherever I go. Currently, I'm living in my 16th city in the last 24 years until June. Next will be 17 after June, July. Coming to social enterprise and their role, I mean, you just walk around in this corridor and you know what their role is, right? And I requested Arima that I should go last so that, all the wisdoms have been said and there's nothing more to say, and that is true. But, between these two, you see a platform and you see a social entrepreneur who has business principles and a passion and a social heart, right? So that's the social entrepreneur. You don't be running any enterprise non-sustainably, right? How do you sustain itself? That's either through philanthropic money or the services and the revenues you generate and mixture of that. But stepping back, if you look at what is happening in India now, there are a lot of engineers, clinicians, social scientists coming together and building enterprises and taking the solutions to the doorstep of people. Right? Casey is an example here. Jenaan mentioned about biosense and others. Now, they're taking to the doorstep, right? And if you step back and look at our country and other geographies like our country, those solutions can grow to the doorsteps of the rest of the world. Number two. So scale I'm hinting at. How do you scale? And by the way, the West is now suffering from really high healthcare costs. So if you do solutions, integrate technology for healthcare, take it to the doorstep of our country, you can actually take to the doorstep not just other geographies like India, but also to the Western countries. Right? And that is the key. So that means your solutions has to be excellent. It's not jugaad. Abdul mentioned to me, this nice young undergrad first year, why I don't believe in jugaad, because jugaad is something that is, just a chalta hai solution. It's not systemic. It doesn't solve a systemic problem. So scale is something that I think social entrepreneurship, even though Casey mentioned that, volumes are less, but, eventually you want to take some of the solutions to almost all of it. And why? By the way, do you know how many Australias we add? We add one Australia every year. We just crossed 140 crores, right? Our burden of healthcare is mostly in the tertiary because primary healthcare systems are dysfunctional, right? So the solutions we're making also has to, choose where you are taking them. So you have to define your doorstep as well. And for social entrepreneurs, doorstep, like what you said, Arima, is about access, affordability, and all of that. So with that framework, if you design something, it will hopefully go to the PSC. The question is now, what is happening in India, right? So if you, at least 5,000 budding entrepreneurs trying to build their products. Some of them have left corporate world, Bosch, Siemens, Intel. Some of them are jumping straight out of undergrad. So there is a veritable mix of exciting entrepreneurs, women entrepreneurs who are trying to build products. And how then the early stage has been done, how do you help them grow is the question. I think we'll come to it. So that's one. But your question about how social entrepreneurs can work, they need partners, right? And generally government is their biggest partner. And as we know, governments speak in several languages on a daily basis. So, and the turnaround time for decision making can be long. So the gestation period for getting a contract can extend their lifetime. I mean, I'm just joking. But so those are the things that they have to integrate in their business models, right? So the frustration for a social entrepreneur is they have to partner with the public system, in this case, public health system. Because I also believe that, we cannot disregard public health system, right? We cannot build a parallel system that's going to overlay on the public system. We have to strengthen our public system. So social entrepreneurship has to be complementary to the systems that we have. So to cut it short, how do you scale? And because you have to scale, you have to partner with the government, because that's where all the scale up can happen. And if you get it right, can you take your solution to the rest of the world? Two people I need to mention. I met Stan, wonderful, and Villgro. If you just look at Paul Basil's life history, that can tell you about social entrepreneurship. The other person I have deep respect as well is Harish Hande. I'm naming him. Harish came back to India in the mid-90s, started a company called Selco Foundation. I don't know how many of you know Selco Foundation. Can you raise your hands? Oh, good. Very good. For those who don't know Selco Foundation, Google it, or maybe Snap GPT it these days. Chat GPT it, right? And then, or I use Bing. Oh, by the way, it's changing. It used to be so boring, but now it's exciting. So Google Harish Hande and see what this person has done. He brought solar cells in mid-90s when nobody knew what solar is. So that's scale. Thank you, Arima.
Thank you so much. This is fascinating. I mean, while appreciating the role of social enterprises in terms of what are the broader principles that really guide social enterprises is something which is very important that all three of you have touched on. I was going to actually ask about specific innovations, but I think you have already mentioned, and Forus is all kind of outside, so I will not get into that. But I think something I'm sure our audience and the students would also be interested to know is that I know Satya, you touched a little bit about that. What is the incubation ecosystem and what does it look like in India? And what kind of support that exists if somebody wants to kind of start something in this journey, right? What is it that what does exist and what is it that they need to know? I'll change the order this time. So maybe Chandrashekhar first. Satya, I'll still keep your promise and I'll come to you last. Yes.
I'm going to say something very contradictory. I don't think the incubation system is pretty good.
Yes.
Okay, so everybody does the same thing, space and people and VC connection and some pitching and all that. I think it's useful to some extent, but I don't think the need, especially if you look at innovation-based healthcare, right? The need is slightly different, right? I'm not saying these are all not important; they're all important. But in healthcare, innovation-based healthcare companies, how to productize something is a very critical thing, right? You can have ideas. You can create a prototype. There is a hell of a lot of difference between what is a prototype and a product, which somebody will put maybe even 10,000 rupees and buy, right? So our ecosystem for productizing has not very well evolved. Our vendor or what you call subcontractors or that is also not very evolved. Our regulatory understanding of how to get products approved is not very well evolved. So for example, simple thing like how will I pass, let's say, a regulatory approval? India is now getting into regulatory clearance is required. So, okay, I'm stuck, I'm not able to pass the test. Is there somebody who will come and tell me how to do power management? That is not really existing. So you can figure it out if you have connections, but there's no single point of contact or 10 things where you can go and get these things done. So I would really say that if you are innovation based, incubation, I think these are things which I would like to see, because it will improve your time to market. It is okay, validating your idea, giving you money, access, pitching is all fine. I'm not saying it's not relevant, it's all relevant. But I think that will stop at one point. If you have to scale, as what he said, I think you need to have a product which is actually good in hygiene from all angles. For it to be the incubation system should actually ramp up and get you connections, how to do clinical trials, how to get approvals, how to package products, how to take it international, how do you price the product. So many things are there, which I think that is what incubation should bring in, other than just whatever today they're doing, which is very good. So when we started, nothing was there. At least now this is there. But I think we should quickly shift to that. Otherwise, 3,000-4,000 entrepreneurs who are creating, 3,800 or 3,900 will fail. So that's the unfortunate part.
Thanks for that question. So are you kind of optimistic in terms of the future would look better?
I think you'll have to always be optimistic. There's nothing
Yes.
to be negative about. See, the fact is that earlier there were 10 entrepreneurs, 9 failed, so 1 succeeded. So today there are 4,000 entrepreneurs, so
Yes.
200 will succeed. So that rate is good.
Okay.
But the issue is,
Yes.
I'm saying that it's not about caution. I think we're just jumping into the bandwagon. It's comparatively a tougher process. We need to kind of get ourselves ready. It's not about, you get an idea and just jump and do all.
Yeah.
So when we also came, we also jumped. We did the same foolish thing. So that's why it took us so long. Right? So I'm saying today we can't afford to fail, because the cost of failing is very high. Right? So we need to ensure that you succeed. And for you to succeed, you should have these ecosystems ready. Right? It's not just the standard.
Casey, as an incubator, feedback noted.
Good.
I just want to share, from our experience, what is available. So I think most of you in this room are students. So if you're looking at getting into the healthcare innovation space, few suggestions of places that you can go. The first thing I would say is don't look out, look in. Look at the actual target segment that you're looking to address and be present in that target segment. This is especially important if you want to work in low income. As Casey was talking about earlier, behavior, socioeconomic challenges, political challenges, there are a number of reasons that influence a person's ability to access and adopt certain healthcare technologies. So the first thing I would say is be present, immerse yourself, especially if you're working in low income. When I was your age and bright-eyed and working in a number of urban slum settlements in Pune, I went in thinking, why is awareness on sexual and reproductive health so low? And we should just do a training program. And after spending time with the communities, I learned a lot more about agency that women have or do not have in low-income populations, in urban slum settlements, in rural areas. I learned about domestic violence. I learned about alcoholism and addiction, and the role that all of these things play in the agency of women, which have a direct impact on their economic opportunity and as well as on their ability to access reproductive health care and have ownership of their own bodies. So be immersed. The fact that most of you are studying development is a great sign, but being part of the communities that you want to serve is super important. The second is, I don't know if you've heard of BIRAC. BIRAC is the government department which supports biotechnology in India and has a number of different initiatives meant for healthcare innovations, to support healthcare innovations, right from supporting PhD candidates to supporting very, very early stage fellowships, to funding a number of different incubators like Villgro, like CCAMP, like Derby Foundation. So there are also incubators then who not only provide support, but who also look at some of the points that Casey was talking about, which are the walking through the regulatory, the compliances. Those take a number of years, require a number of different approvals, just helping you figure out what does it take to get there, whom do you go to. They also give you technical assistance so that the cost of applying for these patents or regulations can be subsidized. We have Arun Agarwal from Janitri in the room. He's one of our Villgro incubators, so he could perhaps maybe later share with some of you what is the type of support you can expect realistically from incubators. Yes, he made it to Shark Tank, and not just made it, also got a great investment from Shark Tank, right? Yes, yes, absolutely. Yeah, so there are a number of incubators and there is support from government. There are also tools, especially for early stage companies. There's a tool that Villgro made called the Innovation Solver, the Innovator Solver. It's meant for anybody with an idea. It walks you through in a sort of gamified way of what are the different steps you need to undertake to understand your product, to refine your product, to understand who your customer segments are. It's a free tool. So if anybody ever wants to use it, please just write it to us. I do agree with Casey that there's a lot more to be done. And I think more incubators are taking cognizance of that. We ourselves have done a complete strategy refresh. Anil's book is really testament to the type of different outlook that incubators need to have and how much more hardworking we need to be in terms of support to social entrepreneurs. So I think it's changing as the ecosystem has evolved. When Villgro started off, there were no social entrepreneurs. Social enterprises and social entrepreneurship was a concept that was still being defined, discussed, debated. What does it mean? Is it a viable way of earning a living? Does it mean that I'll always, not have money in the bank? And today, you have a number of academic institutions, research institutions, incubators, over 600 incubators in the country. But yes, many of them doing the bare minimum when it comes to trainings and workshops and connections. But the ecosystem is vastly different, right? So that's why even Villgro is questioning what is our role today in a place that has so much of this support. How can we be more catalytic? So I think having these conversations, like what Casey just mentioned, is super important so that we're able to be more fine-tuned in the kind of support. But there is some support out there, is what I wanted to say.
Okay. No, thanks, Jenaan and Casey. So let me go back in terms of counterfactuals, right? So imagine you being an undergrad, postgrad, corporate guy, bored in coding in some of these IT companies, or servicing some back-end business processes, and then you decide to do the germ of entrepreneurship hits you, and you want to jump, right? The bug has been there, and all of a sudden, finally you need to jump. Did people do that earlier? Of course, people did that earlier, right? I mean, you look at the kind of enterprises any country, especially India, has built. There have been people who did that in, 60s, 70s, 80s, 90s, 2000s, even now. But if you were to jump now, right, is there an architecture there to support you? The answer is yes. That architecture itself is evolving, right? So 15 years back, or 12 years back, when we were thinking of building BIRAC, so as the former head of strategy at BIRAC, we built like 17, 18 programs. Arun is one of the beneficiaries of that. BioSense is also that. So, a lot of them have taken that support. So there is now anywhere between 100,000 to $2 million support. But money is not everything, correct? There's so much more to an entrepreneur and taking your product to the doorstep than just the injection of capital. Yeah, so that's one thing I need to say that. Why? The first thing is the problem that you are thinking of designing a solution a real problem or not? Right? Is it because you dreamt about it, Is it because you've spoken to hundreds of people who are facing that problem? Is 100 a sustainable product for in the market? So all that an incubation center should be doing, right? So Jenaan mentioned about 600, all of them. BIRAC also started BioNest program, in my time. There's almost 1,800 of them, and some of them are big. Like I sit on a board of India's largest, incubation center, science and technology focused incubation center in Pune called Venture Center. And anytime 90 resident startups there, and you name it, they're building stuff. And if you look at 3,000 startups that BIRAC has funded, so you name it, people are building, products for healthcare, agriculture, environment, now climate change, all of that. But so counterfactually, there's a different architecture now. Right? So you have a support network that you can access at any given time you want to jump. Number two, and I endorse what Casey is saying, like both Jenaan and I endorse him because he's the real life entrepreneur. Right? What me and another guru of mine, Professor Vijay Chandru, we kind of said that we are heading towards something called a graveyard of prototypes in the country. Right? We're building lots of prototypes, great, but they are not scaling. That's my first point. But there is a silver lining in that graveyard of prototypes as well, because that journey that all of you or entrepreneurs are doing, even there is a failure, there is no lived experience of building a product and taking to the market in this country in the healthcare, which is happening in the last 15 years in a very concerted way. So Arun is an example of that. Biosense is an example of that, and all of that. And they are going to hopefully stay in this ecosystem and help, the others who are then hit by the bug and want to jump. So they can be the advisors, right? Who can then handhold them. So hopefully the acceleration to the market, we hope, can then be faster, right? So that's the positive angle of it. But, Casey rightly mentioned that, what I have seen for most, I'm sorry about engineers here, or PhDs holders, right? Especially in sciences. They think that, hey, you know what, I have done a degree in whatever, right? In engineering or in sciences, molecular cell biology, for example, for me. And then somehow that becomes a chip. And we don't realize that actually the social aspects of taking a product to the market far outweighs the technological aspect. The social aspect can include regulatory, can include customer behavior, your go-to-market strategy, all of that, right? There, your laws of thermodynamics don't work. There, the laws of society will work, right? So I think that the entrepreneurs have to understand and integrate into their thinking, especially those that are coming from a science and engineering background. Technology doesn't solve everything. Finally, so to your question, Arima, what is the incubation ecosystem? It has changed. Thanks to places like BIRAC and incubators like Venture Center, CCamp, IKP Knowledge Park, IIT Bombay, Sign, IIT Kanpur, IIT Delhi, all of that. And can it percolate down? These are all big names in big places. Can it percolate down to tier 2, tier 3 places? It is happening. Is the incubation model itself sustainable? There's another panel discussion for that. We won't go into that. But the current situation is that if my friend back there wants to jump into entrepreneurship, there is somebody who can help him now or help her now, which wasn't there before. Thank you.
Mike.
Looks like, what is it that one needs to keep in mind? So thank you so much. What we will do is that we will open it up for discussion. We can take a couple of questions actually. So anyone would like to ask any question, clarify? Yes, if you can pass in the mic. Here, okay, and I think just ask another student volunteer to perhaps hand over the mic.
Hello, good morning, everyone. I'm Arpita Das from Christ University. So my question basically was, we have been hearing about the works of the National Healthcare Policy, basically the Unified Healthcare Interface. I wanted to know that whether a Unified Healthcare Interface from the side of the government will help the rural population or will help in the social sector. Basically, the logistics, the problems, the pros and cons of it, mainly.
Would you like to? Yeah.
But I'm no expert in this, but I'll take a stab at your question. Good question. So, we are building stacks, right? So that's what I hear. You have a health stack as well. The biggest problem that KC will face is when they go and patient information, how it is kept in hospitals, okay? Or different kind of hospitals, right? Or Arun will face and all of that. Because those hospitals don't talk to each other, even if that is a corporate, even if it's a socially minded corporate hospital, correct? So the hospital health information systems don't talk to each other, right? That's one of the biggest things that needs to be solved. Second, with the 5G and other 4G coming, your decision making of, so how many top level, in case you will know that, nephrologists and all these big super specialty clinicians we have in India, hardly any, correct? And they might be only in a certain location of Bangalore or Hyderabad, even within Bangalore in certain pin code areas, right? Bangalore can also represent the whole of India. So in this case, therefore, to Aritra's question, the second is how digital can help, right? So if that can, that information of a patient, either remote, say in Odisha from where I come from, or in a smart city, can then be uploaded. Somebody can see it remotely and can give a clinical decision, either as at least a go no go, in a sense that whether that patient needs further consultation or not. That itself can be tremendously valuable, right? And third is use of that technology to empower our healthcare providers. When we say healthcare providers, we forget our ASHA workers, right? Who are really the ones who are providing healthcare in remote places, in healthcare, in the villages and everywhere. And they, they go through a very tough process of putting down everything on a paper base, and then look at 100 patients. And so can we reduce their burden, number one? Can we also train them to take minimal decisions about healthcare, right? And those things technology will help. So to your question, yes, the health stack being built would be tremendously helpful. Think about UPI, right? Google Pay, this. You go to the West, you hardly see anything. You still use cards, right? And here you walk and somebody selling a hawker will have a UPI, right? So that can be transformational. I urge you to read something called a Lancet Reimagining the Indian Health System.
Yeah.
And Professor Vijay Chandru is the commissioner for that. They probably have a website and things like that.
Yes.
Wonderful
the website.
thing.
Yeah, they have a
Thanks.
website. Yeah. Thanks, Satya.
There's a question from here.
Yeah.
Well, my name is Uday Das. Basically, I also belong from Odisha. So my question is you mentioned UPI, right? It was a database. Why not for healthcare? Still now we have a database. As now I recently studied a news which speaks about Abhay, which has a unification unique identity, which says it has entirely track records of a person to person. So my question it arises, since let's take an example of COVID, which came 3 years before. There we were not having enough number of track records of health records. So there what we did is we gave an entire shutdown to the country which break down the ecosystem in the market for 2 months. And to recover, we took larger amount of time. So my idea was like, what if we were having a database as UPI in India called as UHI, which was maintaining the health records. It would be more helpful for the funded projects as well as the profit making. Like we can have the health records to each and everyone, which will be open and that we can be access for any sort of viral conditions or any biological war happens. We can be ready for that.
Yeah, the answer is yes. Why is not? See, sorry, I'll be joking a little bit now. I'm nothing against the clinicians. Have you seen this, handwriting of doctors? You can't read them. How are you going to build a healthcare record? I'm just kidding. But there are solutions to that too.
Like
No, Arima, there are solutions to that too. You can see, there have been AI, ML model that can read through this and can tell if there is, what kind of prescription it is. But to Uday's question, yes, I think first is the diversity of our country, right? Just imagine, I don't know, I wonder Casey will be again, whether all our prescriptions are in one language, maybe, I don't know, is it English? Not always true. We can be writing on our local language, everything as well. So that's one. Number two, Uday, is people hospitals don't track, right? So all of that. So, but those are a couple of things that can be taken care of. Casey, I'm listening.
So I think answering her and him together, see, I think you should have a common stack which will be very effective, and adoption is going to be the biggest challenge. But what it will actually do is, for example, a lot of NGOs have been funding projects which were building proprietary software. And if you are actually a company, you always want to build proprietary stuff so that your competitor doesn't come in, right? So this has always been the case. And NGOs have been funding lots and lots of projects. Almost 60-70% of them have been on software, building proprietary software. Now, all of them have died a natural death after some time because of lack of funding going forward, right? So instead of wasting money on building the same thing again and again, these kind of standard formats, if it is already there, it will ensure that money is actually spent on things which are relevant rather than hundreds of stacks being built. So I used to work for Philips. At one point of time, we used to have digital signal processing cores, about 7 of them within Philips system, right? So different departments doing the same thing. But the thing is, when we have a country with limited resources, limited doctors, getting into a similar one protocol which will have all of that is very, very, very important. But the point is how it will begin and adoption, how it will happen. So today, digital is a good example that people have adopted because they found it useful. Because the usability is very straightforward, multi-connection. But if I am a hospital and you come to me and I don't transmit this outside, why should I follow? Is always going to be the situation, right? So there has to be some incentive for the hospital to do, or a stick for the hospital to do that, whichever way it happens. So once that happens, it will slowly come into line.
I know, this is very tempting and we can continue to do this. Wonder if we have got to kind of move to the, what you can do. They're going to be around for some time over lunch, so do interact with them. Okay, and I'm sorry that we are unable to take your questions, but do please clarify with them. Okay. Don't mind, please do introduce yourself. Yeah.
Thank you. I am Ram Bala. I am a former Government of India official. I have worked both contributed to the social thing as well as healthcare. While I was in the government, I was the author of a common entrance test for engineering and MBBS admissions way back in '93. Now, then of course I got stagnated there, so I left and joined the private sector, and then came up with several healthcare related innovations. One of which is I reduced the cost of PET cancer scanner from rupees 5 crores in India to 2.5 crores. Now, the two observations I would like to make here. The main reason being, we have a few incubators here and then quite a number of maybe future upcoming entrepreneurs, youngsters. The two observations are, we have this concept called a CSR fund in the Companies Act 2013. There is a general misconception while reading the rules, which says that local development, the fund should be used for local development. So the founders of the company generally think that the local development means it should be somewhere around within 1 kilometer, 5 kilometer, 10 kilometer. That's the misconception, misunderstanding there. The word local development actually means spend that money in India. Don't make profit and go and share it in America, New Zealand and other places. That's what is actual local development. Okay, you are allowed to spend throughout India anywhere. So this is one observation. The second observation, this is actually not mine, but I borrowed it from Rohini Nilekani, where she has started a few social enterprises. Majorly these social enterprises, what they do is they depend on donations from such companies for their continuance. So what happens is these donors develop a sense of donation fatigue. Okay, beyond a point they would not want to give donations. So these social enterprises, they should learn to showcase their services as more as an investment by those companies rather than as a spend. Okay, these are the two observations that I would like to share.
Thank you. Thank you so much, and I know that it's difficult to close the conversation because there is so much, and to kind of different aspects of this to continue to kind of discuss. But again, those who had raised their hands, do get in touch with them and discuss your questions. Okay? Yeah, Ms. Khan.
Thank you very much to all the panelists and Professor Arima for this extremely engaging and insightful discussion. I'm sure that everyone present here has gotten a lot to take away from today.